$600,000 billed to our client in the first 3 months on a custom health plan, a wholesale plan, not a retail plan. Hey everybody, my name is John Millen, Millen Group. I want to share this. This is so amazing. So many companies are not taking advantage of this, and this is why we work so hard to talk to 2 to 3 people a week, new people, and say, hey, where are you? Tell me what your issues are, what's gone on. Have you thought about a custom health plan? Let's see if it makes sense. This is a 3-month report we just came out of with one of our clients. I've de-identified it so you don't know who it is, but essentially it's a nonprofit, about 80 people on medical. Historically, on one of the big insurance companies, 15 to 20% rate increases every year. No idea where the money's going. They were approaching $800,000 or $900,000 of total spend. That's a lot of money to be shelling out, and then having it going up 15% and not knowing where it's going. And they already tried the HSA dance where you put everyone on an HSA plan, raise the deductible, and give a little bit of money. Wasn't working. We came in very quickly, 3 months in, we're starting to get results. We're starting to get data, but it's not relevant yet. It's not mature data. So forget the number. It doesn't mean anything. What matters is what we're seeing coming in. So you got here, inpatient hospitalization. So of the 600, half of it is, I think it's 2 or 3 people that got hospitalized in the hospital. So 312 grand hit the plan. Now the plan is your money. If you're a nonprofit, it's your money that you've allocated to pay for healthcare. No different than you writing a check to the big companies, the big blues, or Aetna, or Cigna, or whatever it might be. But this is your money in a bank account that we use to pay very carefully when it is due. What's fascinating, you see that right there? In review, in 0, 0, 0, 0, 0. We're not paying the hospitals. Now, eventually, not me, the vendors we use are holding, like, no. Something doesn't look right. Before we stroke a check for 300 grand, we're gonna make sure you're not charging us $800 for Band-Aids and $16,000 for the room and things that are nonsense. Why? The entire $4 trillion healthcare ecosystem, take all the different players, everyone makes more money when your costs go up. Everyone, including your broker. Unless you operate as a fiduciary, right, and a fee-based transparent advisor, and you only use vendors that operate on your behalf, not paid by someone else, can you break that cycle? And if you're spending $1 million a year or $2 million, and you don't know where it's going, and you have no control, what are you doing? Like, people are to the breaking point now. So that's one example. In review, second example. This is fascinating. It says here, if you can read it, first choice fill. What does that mean? There are pharmacies where you get the maximum discount. What are they? CVS, Walgreens, Rite Aid, right? Some of the other ones that the big, maybe wholesale clubs that you're familiar with, not so much, it makes no sense. Like, wait a minute, if I go to those big wholesale clubs, don't I get the best price? You may on the cash price, but through insurance, the way we structure things, no. So we track how many employees are going down. Now this is a complete diversion from the industry. In the past 2 years, 2 separate carriers, and I won't name them, but you probably know. One says, no more CVS. If you go to CVS, you're on your own. The second one said, no Walgreens. I was like, holy crap, those are like the 2 near my house. Like, what else is there? And so the industry itself is restricting. What we do is say, you go wherever you want. It's a custom wholesale plan. We're building a custom home, and you can go anywhere you want. In fact, we prefer you going to the ones that you probably want to go to anyways. We don't restrict it. So another thing we look at, again, is fascinating when you understand how the pharmaceutical side works. And last, here's your total spend for 3 months. Forget the number. It's just a number, 600 grand. That's billed. So before we pay the vendors, the stack we create, right, these pieces, we make sure it's legit before we pay it. So right off the bat, they kicked out $60,000 of ineligible charges. What is that? That's someone trying to submit a claim right before the effective date. That's someone not on the plan trying to push it through. Why would that go through? Because the insurance companies typically don't care. Like, let it go through. Why? They make more money, so they're not going to restrict it. When someone's watching out for your bank account, 60 grand, no, they're not paying it. Duplicate coverages, $11,000 of duplicate invoicing. Normally that would go through. And here's a fact, most of the retail plans you're familiar with where you buy it from the insurance company, you can't change it. Most of those auto adjudicate 80 to 90% of the claims, meaning they automatically pay them. No one looks at them, they just pay them. Not with a custom plan. You have a watchdog looking after this. This is a good one. Service not covered. Look at that. Holy moly. Service not covered. That's half of the spend. They're like, no, we're not paying it. What is that? Quick example. When there's something in a hospital operating room, there's usually a primary doctor, right? And that doctor is going to get billed at a certain rate, 100%, whatever their billing rate is, it's going to push it through. Then there may be a second doctor, a third doctor, a fourth doctor, right? What do? Is everyone bills at 100%. Well, the other doctors didn't perform. They just maybe came in, maybe were there initially, they weren't involved. So no, you don't get to bill at 100%, you bill at 50%. Like, we're not gonna pay you at 100. That's what that is. Is that mind-boggling to you? And this is crazy. Incomplete filing, members not responsibility, all this stuff. And then we apply the discount. And the network we use for this client is a national PPO, in and out of network, nationwide. You would know them. It's a really good carrier. So employees loved it. They're like, we went from this little restricted network to like, boom, for less money. And here's what we paid. 60 grand. 60 grand is all the plan paid. How much savings is that gonna be over the course of a year, 2 years, 5 years? That is what you get with a custom health plan. If you want to learn more, reach out, millengroup.com. You can do some quick cost modeling, but this is amazing stuff. And this is why I'm in the basement of my office building at an empty office, all right? This is why I'm here. Someone came in and said, what the heck are you doing? Like, I'm walking around. I got a sink right here. Whoops.